So it will be recorded, and we will be sharing the link to this along with a copy of her slides and a handout that she put together in a follow-up email. You also can always find the recorded webinars on our HealthLinks Resource Center at healthlinkcertified.org. And then at the end of this presentation, a survey will pop up about the webinar. If you could please just take 2 minutes, it should be super short and quick, and let us know what webinars you'd like to see in the future. We really want to bring to you what you're looking for. So, Tori, I will let you take it away if I can once again find the remote button. All right.
Okay, great. Thanks so much, Kaylee. Let me just see if this works.
Oh, I apologize. I guess I was supposed to also cover the benchmarks for those of you who are not familiar with HealthLinks. This is what happens when you don't read through the presentation fully. I apologize, everyone. These are our HealthLinks benchmarks. It's comprised of our assessment that you take when participating in our program. So you, if you ever are interested in learning more about these, I can share, but basically organizational supports really takes a look at what you're doing in terms of leadership support, resources, and benefits for your employees. And then workplace assessments focuses on how you can get employee feedback and implement that into your programming and policies, as well as any other data you may have available to you. Health policies and programs benchmark focuses on what you're doing to target certain health behaviors or family-friendly practices, things of the sort. Safety programs and policies address safety. And so if you're looking at ergonomics or if you are addressing slips, trips, and falls, things of the sort. Engagement takes a look at how many people you're reaching within your organization, as well as any spouses, dependents, or the larger community. And evaluation is about your program. Are you evaluating it? Are you collecting any data that would help? Oops, I apologize. I see a chat box came up, and I don't know, Tori, if you can reach that, because I think with your remote control, I'm unable to actually click on the top.
Let me see here. Okay, can you all hear me? I know, Kaylee, you can hear me, right?
Yes, I can. Oh, I see a bunch coming through. I just can't open it.
Thank you. Perfect. Thanks, everyone. And Kaylee, should I go ahead and get started, or do you, sorry, we kind of.
No, I apologize about that. I keep forgetting with the sharing control of my screen. I'm unable to click on certain things at the moment, but I trust that you're reading those questions that may have popped up. But please go ahead and get started whenever you're ready.
Okay, perfect. Thank you. I'm just going to forward through this slide to my first slide. So hi, everyone. First of all, I just want to thank Kaylee and the HealthLinks team for having me. I'm really excited just to talk to you all today about sleep and fatigue, and hopefully I can answer some of your questions. And yes, and I can see the chat, so feel free to send me chats throughout, and I'll, if I don't answer them during the talk, I can also, I'll leave some time at the end for questions then as well. I'm Tori Crain. Before I get started today, I want to tell you a little bit about my background. So I first got interested in sleep and fatigue as an undergraduate research assistant at Washington State University. So while I was there, I was working on both laboratory studies and field studies at the Sleep and Performance Research Center, working under Hans van Dongen and Greg Belenke, who are two of the biggest experts around sleep and performance. And while I was there, I got some pretty cool opportunities to work with commercial truck drivers and also airline pilots on sleep and fatigue studies, looking at how their shift work impacted work performance and cognitive functioning. But what was interesting while I was there is that I was talking quite a bit to these pilots and these truck drivers, And they would tell me stories oftentimes about how it wasn't just their work schedules that were impacting sleep. It was also other things going on in their life. So family issues, maybe they had a new baby, partner was upset because they were gone a lot for work. So I then became really interested in work and family issues. And so you'll see after Washington State University, I then went to Portland State University and got my PhD there in organizational psychology. I worked with Leslie Hammer, who's an expert on work and family issues. And I was really lucky because I got to incorporate a lot of my sleep training into that as well. I also spent some time during my PhD program at the School of Public Health doing an internship. And I was working there under Noah Satius. We did some pretty cool studies with janitor health and safety and also steel worker health and safety. So got a little bit more of an interest on the safety side when I was there as well. After graduate school, I then went and worked for a year at the Oregon Healthy Workforce Center, which is a NIOSH Total Worker Health Center of Excellence. And while I was at the Oregon Healthy Workforce Center, I was really trying to increase my training and expertise around intervention work in the workplace and randomized controlled field trials. So I primarily worked on a project there with construction workers where we were doing an intervention to try and improve construction worker work and family stress, but also safety as well. And then 3 years ago, I got hired at Colorado State University, so I'm an assistant professor here in the psychology department. And all of the work that I do focuses on sort of what I call the three big domains of our life: work, non-work, and sleep. So if you think about it, the average person spends about 8 hours a day at work. If they're lucky, they spend about 8 hours a day sleeping. And this leaves about 8 hours a day for non-work time or family time or leisure time. So everything that I'm doing now is really focused on understanding how work, non-work, and sleep interact with one another, conflict with one another, and in some cases may even be beneficial for one another and enriching. So that's just really quick, a little bit about me. And let me move on now. So here's the plan for today. I thought I'd give you some background on sleep to start out with. And then I wanted to move on and talk a little bit about what should your organization, why should your organization care about sleep, and how can your organization improve sleep? I'm going to incorporate just a little bit of my research, but in general, I'll be focusing sort of more on broad topics related to sleep and work. Okay. So now that you know that I'll be talking about sleep today, I thought it might be helpful to just give you a snapshot of where we're at with sleep in the US. So you might have heard a lot about this in the news. Sleep right now in the US is of concern. So there's quite a few different organizations out there and individuals who are claiming that we're in a little bit of a sleep crisis, poor sleep epidemic, if you will. And so these are data from the CDC, and this is the prevalence of short sleep duration, so people getting less than 7 hours of sleep. And if you look down in the right-hand corner, you should see the figure there. And so the darker the color, the higher the percentage of individuals who are getting short sleep duration. And we define that as being less than 7 hours of sleep because what we know is from a review of the empirical literature today that below 7 hours of sleep is when we start to see major physiological and neurobehavioral decrements in functioning. So 7 hours really seems to be the minimum at which we start to see these really negative consequences. And so what you'll see from this graph or this map is that the majority of deficient sleep or low sleep duration, it tends to happen or seems to happen in the South and Southeast. Now, this is somewhat interesting. Why does it seem that it's happening primarily in that area? We see it a little bit over on the West Coast South too as well, but we really see it concentrated in the South and Southeast. And there's a number of different reasons for this, but I think one of the most important things to mention is that there are some environmental determinants of sleep. So we know in order to sleep well, you need it to be three things: cool, dry, and dark. So I'll come back to that throughout the talk. Cool, dry, and dark are really important. And if you think about the South and Southeast, well, these are areas that are particularly humid, not necessarily dark, and hot as well. So the environment there just isn't great for sleep. Another reason why I think we see it concentrated in this area, and you tend to see this throughout some of the other counties within the U.S., is that there's an association between sleep and poverty as well. So there's some really interesting anecdotal reports of in high crime areas, what police departments will do is they'll put up floodlights to try and deter crime. Well, then you have certain neighborhoods with lots of light coming in through windows, not allowing people to get good sleep, access to all of the other things that we think about with health disparities, healthcare, good food, ability to exercise. All of these types of things are also associated with sleep as well. Now, of course, many of you know, if you look at maps of cardiovascular disease, obesity, diabetes, other chronic health issues, they look very similar to this. And so we know that sleep is linked with chronic health. It's really closely linked. I'll come back and talk about this a little bit later. I drew a box here around Colorado. Colorado, as you can see, we're actually doing pretty well here. Sleep is pretty good. I think a big determinant of that is it's very dry here and it's a temperate climate, so it's a really good environment for us to sleep. But again, you do see some variation within the different counties. Okay. And I just see Jeffrey Henderson shared a comment here. Thanks so much, Jeffrey. Yeah, yeah, definitely. So chronic health conditions have a higher prevalence in tribal areas. I think that's definitely represented on this map as well. And certainly sleep issues go along with that. So thank you, I appreciate that. Okay, let me advance. All right, so before I move on, wanted to just make a couple distinctions and share a couple definitions that I think will help with the rest of my talk. So one thing to note with the field of sleep research is that it's very diverse. There's a lot of different subfields within the larger field. But one way to sort of make a distinction within the field is that some of the research and practice that's done is focused more on these clinical populations. So these are really medical doctors and physicians who have training in sleep science and clinical sleep medicine. And these individuals focus more on things like sleep disorders. So of course, sleep apnea, insomnia, restless leg syndrome, those types of things, in addition to pharmacological and behavioral treatments. And then you also have sort of another group of researchers who are more focused in these different healthy populations of sleepers. So individuals who are generally healthy, but just aren't quite getting enough sleep for a variety of different reasons. And so what I'll say is that over to the left-hand side of your screen, you sort of see these sleep disorders. Over on the right side, if you're doing research more around healthy populations, you're more focused on this idea of chronic sleep restriction, or this idea that most people in our country, they're not necessarily sleep deprived, they're just not getting enough sleep. So they're restricting themselves, or because of work or stress or other factors, are getting lower amounts of sleep, maybe in the 4 to 6 hours a night range. We would call those people chronically sleep restricted. And then another term that I hear used a lot, and it's a personal pet peeve of mine, all of my students get this feedback in class, that total sleep deprivation, in the sleep field, when we say total sleep deprivation, this means that you have not gotten any sleep at all in the last 24, 48, or et cetera hours. And so a lot of people will say, oh, I'm so sleep deprived. Well, really, you're probably just chronically sleep restricted. You probably just haven't been getting quite enough sleep. However, we do know that total sleep deprivation, it does occur in some extreme environments like military settings, and then additionally, there are some clinical disorders where we do see some total sleep deprivation as well. So I just wanted to, before I get into more of the talk, wanted to make that distinction between sleep disorders, total sleep deprivation, and sleep restriction. And then also just alert you to the fact that today I'm going to be focusing more on these healthy populations of workers who are really just sleep restricted. I'm not a clinician. I don't claim to be a clinician. So if you have questions about sleep disorders or treatments, I can certainly steer you in the right direction and try and give you resources related to those or connect you with people. But my focus and training is really with these healthy populations, not so much on the clinical side. Okay. So another couple definitions I wanted to share. So a lot of times when we talk about sleep, we don't really distinguish between sleep quantity and sleep quality. So sleep quantity refers more to our sleep duration or the total time spent sleeping. And then sleep quality, on the other hand, it refers to a number of different constructs, but for example, individuals' own self-reports of the quality of sleep that they get, reports of feeling rested when you wake up, and then also insomnia symptoms is captured with this as well. So insomnia symptoms refer to difficulty initiating sleep, so falling asleep at night, or maintaining sleep throughout the night. So potentially you could be waking up too early in the morning. That would be, and that would represent insomnia symptoms as well. So I think it's really important to distinguish between quantity and quality because, for example, you could be getting a good 7 to 8 hours of sleep a night, but your quality could be very poor. And so you still might be seeing the same decrements as if you were getting shorter amounts of sleep. On the flip side, you could be sleeping very short amounts of time, but having very high quality of sleep. And that would not be ideal either. So what we recommend is that you want to be getting 7 or more hours of sleep, and you also want to be getting high quality sleep that's marked by things like feeling rested when you wake up, being able to fall asleep easily. We usually say about 15 to 20 minutes you should be able to easily fall asleep, and then also that you're maintaining sleep throughout the night. Now, if you're experiencing difficulties with any of these things, and they're persistent, lasting more than a few weeks a month, then it's probably time to see a healthcare provider and get some feedback from them on what's happening and which way to go. Now, I do want to address, you'll probably see in the media, I see this a lot, we have current and past presidents who will even say this, that people can survive on very little sleep and that they don't need a lot of sleep. So there's lots of reports of people who will say, oh, I'm just fine with 4 hours. Now, what we know is that people are not good judges of how much sleep they need, unfortunately. I'll come back to this later in my talk. We have seen that there is some new research coming out that suggests that there are some very select few individuals who have a genetic predisposition to being able to not sleep very much, say 4 hours a night, and still function just fine. However, what the research suggests is that we estimate that the percentage of the population who fits into this category is really about like 1% of the population or less. And so there's a lot of people out there who are claiming that they don't need that much sleep, but in reality they do. So I'll come back to this a little bit later. Okay, so I want to move on now and talk about why should your organization care about sleep. Okay, so why do we need sleep? Well, it turns out that we don't fully know why. There's a number of different theories that have been proposed with rationales for why we think we need sleep, and it's likely that multiple of those theories are in fact correct. Probably for the workplace, the most important function of sleep is this idea of restoration, or that sleep serves to regenerate and rejuvenate our resources at night. Now, this is really important because when we have this restoration of our physical, psychological, cognitive resources, what we see is better neurobehavioral functioning and also lower levels of chronic illness risk. So let me go into a little bit more detail on that in the next slide. Okay, so, and I apologize, I had animation on these slides, but the animation, it's not working, so I'll try to walk you through carefully some of these more complex diagrams. So let me focus this specifically on chronic sleep restriction. So again, most individuals in the US are not sleep deprived. They're chronically sleep restricted, meaning they're getting less than 7 hours of sleep per night. Now, the estimates vary, but we think somewhere around 20% of individuals are restricted. Other estimates say 1 in 3 people is not getting enough sleep. And in terms of the reasons why people are sleep restricted, well, there's a lot of reasons, some environmental, some individual. But what we know from some of these large-scale time use studies is that the #1 correlate of not getting enough sleep is actually the amount of hours that we work, okay? So work is probably one of the main predictors of why we don't get enough sleep. Interestingly, another very high correlate of not getting enough sleep is our commute time. So workers who are commuting a lot, we know that they tend to sleep less. Additionally, we know that family or leisure time gets in the way of sleep. Technology more and more is influencing our sleep. One important thing to note is that other health conditions can impact our ability to get good quantity and quality of sleep as well. Stress and a number of other factors. So there's quite a few different reasons why people are chronically sleep restricted. That being said, so chronic sleep restriction, based on the literature, it results in a number of different outcomes. So let's look at just the top path along the top of your screen first. And so what we know is that people who are chronically sleep restricted, we see decrements in their vigilance and reaction time. We also know their working memory is poorer, and they see declines in mental arithmetic and other cognitive tasks like this as well. And why is this important to us? Well, it's important because this really translates to accidents, injuries, and decreased performance in the workplace. And I just saw a question from Dee is, will your presentation be made available? Yes, I believe Kaylee will email that out to everyone, so absolutely. Thanks, Dee. And so that's the top path. The below path, or excuse me, the middle path here, let's focus on that next. And what's important is, in addition to sort of these neurobehavioral decrements, we also know that chronic sleep restriction results in an increased risk for chronic health issues, okay? So we know that if you're chronically sleep restricted, the literature shows that you are going to have an increased stress response, so you're more likely to be activated physiologically and emotionally in response to stressors in your environment. You have lowered immunity, so you're more likely to catch a cold or a virus. You have reduced glucose sensitivity, which is a risk factor for diabetes, higher rates of inflammation, and also an increased appetite as well. And unfortunately, when you're sleep restricted, you don't have an appetite for the good things like whole grains and veggies and protein. You have an increased appetite for things that are very high caloric, high sugar-based foods, and high fat-based foods as well. Now, this is all important because it results in and is correlated with these chronic health outcomes of things like BMI, diabetes, cardiovascular disease, cancer, and even all-cause mortality. Okay? Now, I put this here along the bottom. So an interesting thing to note is that even though chronic sleep restriction results in all of these detrimental outcomes, people, again, are not good judges of how much sleep they need. So what happens, and laboratory experimental studies have showed this, there's some really important, interesting work by Hans van Dongens that shows that if we restrict people's sleep in the laboratory, say down to 4 hours a night or 6 hours a night, and compare them to people who are getting 8 hours a night, what we see is that over successive nights, so over, for example, 2 weeks of time, over those nights, we see that what people will say is that they'll say, during the day, I'm getting sleepier, I'm getting sleepier, I'm getting sleepier every day. But then after a few days, we see that their sleepiness reports start to plateau. And so people start to think and report that they're getting sleepier, and then they say they're plateauing, they're sort of adjusting to these new sleepiness levels. Now, if you compare those self-reports to the objective reports of performance, so cognitive functioning, cognitive behavioral test batteries, what you see is that people actually perform worse and worse and worse and worse. So you have a situation where performance is decreasing constantly, and while sleepiness reports decrease somewhat towards the beginning, then they start to level off. And so what this means is that people are not good judges after a few days of chronic sleep restriction of how sleepy they are. So they think they can do more, they think they're more safe, these sorts of things. Okay. And I see quite a few questions. I think for the sake of time, I'm going to keep going on, and I'll come back to the questions at the end. Thanks so much. I appreciate the questions, and I'll try and get to them at the end. Okay. Now, in addition to those consequences I just mentioned, so decreased neurobehavioral, cognitive functioning, and also chronic health outcomes, I wanted to share with you just some really cool new findings that are coming out of the literature that I work in, which is organizational psychology. So not necessarily sleep scientists, but organizational psychologists are starting to understand the importance of sleep and have started looking at this within our studies in the workplace. And what we find, what researchers have found are some really interesting things with new outcomes. So I'll start at the top just with employees. So what we see here is that a lack of sleep or chronic sleep restriction, this has been associated with more work withdrawal. So more absences from work, more presenteeism. So this is being at work, but not really being able to work at your full capacity. We also see lower levels of engagement at work. There's also some new work that's being done by David Wagner and Chris Barnes, where they look at unethical behavior in the workplace of employees. And what they find is that employees who don't sleep as well, they actually themselves report that they're more unethical in the workplace. So doing things like claiming another employee's work as their own, or actually cheating on different things. And supervisors will also report on unethical behavior. And we see that a correlation between supervisors' reports of unethical behavior and employees' own reports of their sleep as well. We also know that employees engage in fewer helping behaviors, so they're less likely to help out a coworker or to do something over and above their job to help improve the organization. There's some work that suggests that less sleep also influences lowered goal levels. So for example, you might set some goals for yourself related to work. If you're not sleeping enough, you tend to not meet those goals, and then you revise those goals downward. And individuals who are more sleepy, it's suggested that those sleepy individuals, they'll revise their goal levels lower to a greater extent than individuals who are sleeping more. That's kind of interesting, I think. And then lastly, there's some work that suggests that sleepy employees perceive more workplace unfairness. They've showed this with pay. So employees who aren't getting enough sleep, they perceive that their pay is less unfair than other workers. In terms of supervisors, some really new interesting research that's coming out of this from Chris Barnes. And what he shows is that supervisors who are sleepy, who don't get enough sleep, they're more likely to engage in minor abusive behavior. So these aren't major abusive acts. These are more minor acts like being hostile to employees, being passive aggressive to them. And we see that this actually over time influences relationships between supervisors and their employees. And then lastly, there are some new organizational implications related to insomnia. So some work done by Kessler shows that Insomnia results in lost work performance in terms of presenteeism. So again, being at work but not really getting all of your work done or functioning at your highest capacity. And what that research suggests is really that individuals in that study, there was about 7,000 individuals, and what they estimate is that those workers who had insomnia, they lost about 11 days a year in terms of productivity. This generalizes to about $2,000 a year per employee. And then they did some estimates generalizing this to the larger US national workforce. And their estimates suggest that insomnia is costing our workforces about $63.2 billion if we can extrapolate from that study. So I think that's pretty interesting to see a dollar amount tied to just one aspect of sleep, which is insomnia. But again, there's also other aspects of sleep quality and sleep quantity too. Okay, so how can your organization improve sleep? I wanted to share just a couple of my own studies. I'm going to share these at a really high level. I have included the references here in case you're interested in learning more. I'm happy to answer questions too. So all of the work that I do around sleep, I'm really trying to work within organizations to decrease stress in order to improve downstream effects on sleep. So everything I target in my intervention work, in my experimental work, is really trying to target that stress so that we can improve sleep over time. So the first study I'll present is from the Work, Family, and Health Network. In this study, we were trying to decrease work and family stress to improve sleep. And then I'll present briefly another study where we did a mindfulness intervention with teachers to improve their sleep over time. Okay. So this is the first study from the Work, Family, and Health Network. Interestingly, we know that two of the biggest stressors that people face are family-related stressors and work-related stressors. And then if you combine those two and think about how your work life conflicts with your non-work life, we know that's a major stressor for people as well. And the research suggests that that work and family stress, it's definitely associated with having poor sleep quantity and lower sleep quantity and poor sleep quality as well. So what we wanted to do in this study was target this work-family stress to improve downstream sleep. So we worked with a Fortune 500 IT company. We had about 7,000 employees and all of their supervisors. And I'll tell you more about this intervention. So the actual intervention, it was focused on 3 different main components that were supposed to target that work-family stress of employees. So first of all, what we did is we had a 1-hour computer-based training for all supervisors where we taught them about the importance of supporting their employees' family life. So we actually taught them behaviors for how they can better support non-work life, like checking in with employees, asking about how employees' family are doing, asking about hobbies, non-work things. We also taught them how you can sort of shift schedules around to help employees to better accommodate their non-work lives, or rework work tasks so that it can better accommodate employees' non-work life. And then what we did is after we taught them about those specific supportive behaviors that they could do, supervisors then did 2 bouts of 2 weeks of behavior tracking where they had an app and they would track when they were supporting their employees with these specific behaviors. They could also set goals for themselves, and they got feedback on whether they were meeting those goals or not meeting those goals. And then lastly, over the course of 3 months, we engaged in some very large facilitated sessions with upper administration, supervisors, and employees, where everyone got together and talked about how can we improve workplace policies and practices to better support employee non-work life. So those were the 3 main components. If you're interested, this is a very large-scale study, and I'm just presenting on the sleep results, but we have lots of other papers and results. So I've included the website on this page. You can also access some of the intervention materials as well. Okay, so what did I find? So we found that For the group that got the intervention, with the supervisors who got the intervention, we found two really great things. First, that total sleep time was improved. So if you were in the intervention group, we saw that your sleep was increased at 6 months after the intervention, 12 months after the intervention, and 18 months after the intervention. That effect was still there. It was on the order of about 13 minutes per night, which doesn't seem like a lot, but actually these effect sizes are in line with what we see in some of the clinical literature, with some medications that we can give to people to help improve their sleep and decrease insomnia symptoms. So we think it's really great that we found this without using any sort of pharmacological treatment. We just were trying to decrease stress in the workplace. We also get some reports of sleep quality. So people reported that they had insufficient rest less often, and this was also the case at 6 months, 12 months, and 18 months. Now I have a picture of a watch here on the page because we collected both self-report sleep and actigraphic or objective sleep. So this is an actigraph. It's a wristwatch-like device. It's similar to a Fitbit. It's just much better validated, research grade, and what it does is it uses physical activity and an algorithm to derive estimates of wake and sleep, so we can get an objective report of sleep that's not as biased as some of the self-reports. Okay, so let me move on to the next study. So this is another study I did. So in the last study, we were working with IT workers. And when you work with IT workers, there's lots of room for flexibility. So we can teach supervisors to be more supportive. They can change work schedules around. They can help us decrease stressors in different ways. But with teachers, that's not always the case. We know that teachers have very high burnout rates. They tend to turn over and leave school organizations fairly quickly. And so we were really interested in trying to help teachers. However, the problem with this is that teachers, there's not a lot we can do to change shift schedules. There's not a lot we can do to have supervisors be more supportive, because teachers oftentimes aren't working that closely with principals. So we needed a different route to try and decrease their stressors. And so what we did is we focused on mindfulness. So this is a project I did with Rob Roser, who's a developmental psychologist and mindfulness expert. And we wanted to target and improve teacher mindfulness and see if this affected sleep down the line. So mindfulness, a quick definition here, is it's really the self-regulation of our attention on one's immediate experience. And then additionally, it's an attitude of openness and acceptance with regard to one's present moment experience. So the idea here is that more mindful teachers would be better able to cope with the socio-emotional stressors that they face every day with kids in their classes, overcrowded classrooms, tight schedules, these sorts of things. So here we wanted to focus more on the individual teachers rather than changing the work environment, because we're just so, school environments are tightly regulated. We just didn't have that much opportunity to change the work environment. Okay, so this study, we had about 113 elementary and middle school teachers, and the intervention was called the Stress Management and Relaxation Techniques Program. It was an 8-week program after work, 2.5-hour sessions, 36 contact hours total, and 2 full Saturday retreats. The program content was focused mostly on mindfulness-based stress reduction. We also did some work around mindfulness and emotions and mindfulness and forgiveness as well. So there was sort of these more didactic sessions where we taught participants about mindfulness, gave them chances to practice. There was yoga and meditation exercises, there was homework exercises, and then there were also some group sessions as well where they talked about their progress in the program. Over here on the right-hand side, this is just the recruitment flyer that we use. Okay, so here are the results that we found. So everything in red is significant, everything in black was not significant. So let's just focus on the post-mindfulness training box, that first tall box in the middle of the screen. And so what we found is that if you're randomized to this mindfulness condition, you are more likely to report less negative moods at both work and home, more satisfaction with work and home. And in terms of sleep, we saw that you had not necessarily increases in quality, but we saw that you had more sleep quantity, fewer insomnia symptoms, and actually you reported that you were less sleepy on the job as well. And then at the 3-month follow-up, we found that negative moods were still increased at both, increased at both work and home. That effect with satisfaction seemed to wear off over time. And then with sleep here, we found effects on both quality and quantity, but not insomnia symptoms or sleepiness. Now, it's interesting that quality showed up at 3 months, but not at post-test. We wonder if that's because it took some participants some time to really engage in those mindfulness practices after the program to really start to see those effects manifest. Okay, so those are just a couple examples of the work that I've done related to stress and sleep, but I wanted to give you more of an overall broad picture of what are the other ways that we can think about sleep and help to improve sleep. So I want to talk about this at a federal or state level, an organizational level, and an employee level as well. So we'll start out with at the federal or state level. And some things that I think and that the research suggests are really important for improving sleep in our country. First and foremost, include healthcare. So it's really important that people have access to sleep doctors, that they have access to diagnostic testing for sleep disorders. And so first and foremost, we need healthcare so that we can take care of our country's sleep needs, especially related to the more clinical side. Now, additionally, at the federal and state level, there are duty hour regulations. So if you're familiar with the National Transportation Safety Board or the FAA, Federal Aviation Administration, they both have duty hour regulations. But what I think is interesting and important to note is that in some industries, these duty hour regulations seem to be less effective or not always abided by. So an example is the American Council of Graduate Medical Resident Assistants. They recently, for medical residents, they in the last 10 years have been trying to improve those duty hour limitations. Medical residents are known for working these really long, strenuous shifts with not a lot of breaks in between. There's some really interesting work that's come out by Landrigan and colleagues where they actually looked at some different institutions, hospitals, during the time that these duty hour regulations were being implemented and trying to be improved. And what we see is that even though the regulations were improved, that didn't mean that the medical residents worked less. In fact, there was no difference. They were working the same amount of time, and they reported that they just weren't telling people that they were working these longer hours. And so this is really important because I think even if we have these federal regulations, which are very important, organizations also have a responsibility too to be sort of establishing these positive climates around sleep and working the right number of hours so employees can stay safe and healthy. Another interesting thing that sleep researchers are starting to advocate for is the elimination of daylight savings time. So there's some really interesting work that suggests that based on national NIOSH data sets, that the day after daylight savings time, when we lose an hour, the work shows that in the mining industry, we see a significant increase in injuries and accidents on the day after daylight savings time, after just losing 1 hour of sleep. Now, keep in mind that individuals tend to be chronically sleep restricted on the whole. So then we take away 1 less hour, and okay, now we're at even greater increased risk for accidents and injuries. And so this is something that's new that sleep researchers are really starting to advocate for, is to just eliminate it altogether. Okay, now at the organizational level, so I think, probably first, the most important thing, again, is healthcare, access to wellness programs. We know that obesity, exercise, nutrition, all these things are associated with sleep. And so we really need good preventative care programs, especially within organizations that can help employees so that they can get more sleep, but also having access to clinical sleep care as well is really important. I have here in blue decrease stress and use flexibility with work schedules. So I gave you a couple examples of that today with my research, but those seem to be really good predictors of sleep. So if we can target those two things, this can give people more opportunity to sleep better. There's some new work that's coming out by Gunia and Adler and colleagues, and it's on this idea of sleep leadership, or the extent to which leaders in the workplace and supervisors in the workplace are asking employees about their sleep and encouraging them to get good sleep. Additionally, most of this work has been done in military settings so far, so there's an additional component that these researchers have been looking at, which is to make sure that employees have good environments to be napping in. So again, cool, dry, and dark. But I think in other workplaces outside of those more extreme settings, there's a lot that can be done related to just making sure that employees are getting asked about their sleep and being encouraged to be getting enough sleep. I think another important thing with leaders is, are you modeling good sleep behavior yourself? So are you sending emails at 2 a.m. in the morning? Are you sending emails all the time on the weekends? So one thing that we can do is just as leaders be good modelers of sleep ourselves. Allowing for breaks in napping, if possible, is great. Napping is a little bit of a contentious topic. So the clinical sleep people, the sleep docs, oftentimes they don't like napping because they're working with individuals who, if they are taking naps, it's preventing them from getting good sleep at night. So a lot of times if you have a sleep disorder like insomnia, napping is really not recommended. But then there's another side of the sleep field that really advocates for napping within operational safety sensitive settings. We know that napping is a really good way to deal with shift work and to help prevent accidents and injuries in the workplace. So just know that there's a lot out there in the media about napping. The truth is that it really depends on a lot of different factors, and especially whether you're talking about a clinical population or a population of workers who are in safety-sensitive environments. And then lastly, reduce the need for technology use during non-work hours, because we know that screens give off blue light. Blue light suppresses our melatonin, which is a hormone that prevents us from getting good sleep. So those actigraph sleep watches that I showed you earlier, those actually capture blue light data. So one thing I'm really interested in is looking at how people, when they're exposed to screens through that blue light, how do they sleep worse? But that's one thing you can do, is try and eliminate the need for employees to not be in technology right up until until bedtime. But I know that that's a hard, difficult obstacle today. Okay. And then lastly, let's just talk about what employees themselves can do. So the first thing is to aim for 7 to 9 hours with consistent bed and wake times. The consistency is really important. Establishing that routine or habit will really help. If you have persistent sleep problems, consult a healthcare provider. That's really important. Manage your stress with things like mindfulness, but also just establishing a relaxing bedtime routine can be really helpful. Regular exercise, we know that this really improves sleep and helps sleep. I also have a bullet point here, know your chronotype. So chronotype is this term for the fact that we actually all have a predisposition towards being a morning person or a night person. You probably know what you are, and it turns out that most people are actually somewhere in the middle. But as an employee, you can think about scheduling yourselves to work when your body wants you to work, when you feel like you're able to work best. You're probably a good judge of that. Limit your blue light after dark from screens and smartphones. Caffeine is good to use to combat fatigue, especially during shift work, but limit your caffeine intake in the afternoon. That can disrupt sleep. Alcohol is another big one. I know that alcohol makes you feel like you can fall asleep easier, and it does, but it's actually, it disrupts your sleep in the last third of the night. So you'll fall asleep faster, but you won't get as good of sleep, and you won't sleep as long. So alcohol is really something to to stay away from as well. And then lastly, the bedroom environment is really important. So your bedroom should be reserved only for sleep and sex. You should not have a TV in there, no smartphones in the bedroom, desks in bedrooms where you do work, that's a big no-no too. Try to keep it just for sleep and sex. And then lastly, cool, dry, dark, and quiet. So some of the most important things you can do is make that environment really conducive to sleep. Wear earplugs, wear an eye mask, get blackout shades, make sure the temperature is right for you. That can be some of the biggest, most important things to help you sleep. Okay. Now, I included some helpful resources here. These are also on the handout that Kaylee will send out. So I gave some websites for good, healthy sleep tips. If you're interested in finding an accredited sleep doctor, accredited by the American Academy of Sleep Medicine, there's a link there, information about sleep disorders. And I really didn't talk about shift work today. There's a huge literature on shift work. I gave one website here, but also definitely a topic associated with sleep. Okay, so a quick question for you before I answer some questions is, now hearing this talk and just that maybe hopefully sleep is a little more salient to you, what can you do to improve your sleep? And then also what can be done to help improve sleep within your organization? I hope as you leave today, you're thinking about these two questions and putting into practice some of the things that I've talked about. So with that, thanks so much for your attention. I'll leave my contact info here. It's also on the info Kaylee's sharing. And then I think I have a few minutes for questions. Kaylee, if that's okay with you.
Yeah, definitely.
Okay, I'll take a few questions here. Thanks so much for writing in. I really appreciate it. And let's see. Okay, so Indira, I believe, asked a great question. How can chronic sleep restrictions impact workday start times? We are reviewing our work start times and have some people who start early and some who start later. What do you recommend? That is a great question. And I hope you're in a company where you have the flexibility to let people choose their start times. Mostly because of that chronotype issue. We know that some people, they like to get up earlier and they're better working earlier. Other people, they like to get to work a little bit later and work a little later. And that's good. We should be helping employees work when their body is wanting them to work. Another thing that flexibility does is it allows people to deal with their non-work schedules as well. So family life, leisure time. And so we know that giving these flexible schedules also decreases work, non-work stress, and that can help sleep as well. So that's my feeling. If you can do that, that's great. If you don't have the flexibility, the reality is that a little bit later of a start time is probably more beneficial for people than an earlier start time. So we do know that shift workers who start earlier between 4 and 6 a.m., they do tend to have shorter sleep durations on average compared to people who are working normal hours. But again, I know that can be really hard if you don't have that flexibility. So I would say flexibility if you can. If not, aim for a little bit of a later start time than an earlier start time. I hope that answers the question. If not, please feel free to shoot me an email and I can follow up. Okay, so Leslie asked a great question. She said, what happens when you are both a morning and a night person? That's a great question. It could be the case that sometimes you're a morning person and sometimes you're a night person, and it's probably mostly being driven by external things that are going on in your life, other work or engagements, family engagements. One thing that I always try to do is when I go on vacation and have maybe a week to just reset, I really try to pay attention to, am I a morning person, am I a night person, without the other sort of environmental constraints that are usually happening. And so that can be a good way to try and figure out if you really are both or just one. Again, most people are somewhere in the middle between being a morning and a night person, and that's just fine. That's normal. I think one important thing is if you are swinging towards one pole rather than the other, just to do whatever you can to try and schedule your life in a way that is in accordance with that preference. But again, that can be really tough. Dee shared a question that was, my workplace environment does not allow napping. Dee, I think that's a really good point. A lot of workplaces don't allow for napping. Unfortunately, I think, one thing that we can do is we can just give employees breaks. So we know that even if people can't nap, a break can be really helpful for those cognitive resources, physical resources. So hopefully your workplace is allowing you for breaks. And then, the other thing is that if you're getting good 8 hours of sleep a night, 7 to 9 hours of sleep a night, you really shouldn't have to be napping. So hopefully your work can accommodate that too. Okay, well, Kaylee, I think we're almost out of time, so I'll let you finish up. But thanks so much for everyone for tuning in. And if you have any questions, feel free to shoot me an email. And I just appreciate you being on the call.
Thank you so much, Tori. This was so informational. I loved it. I'm excited to share with the rest of the group. Thanks, everyone, also for being on the webinar today. These are the upcoming webinars that we have, as well as we're highlighting the Colorado Culture of Health Conference. That's going to be May 2nd. We're going to do a workshop the day before as well, myself, Josh Scott, and actually a student up at CSU in the Occupational Health Psychology program. Adeline is going to be presenting with us on employee engagement strategies and meaningful work. So we're really excited for that. That'll be May 1st with more details to come. And the conference is going to just be a great place to network, learn about the latest stuff happening, and reveal the winners of the Governor's Workplace Wellness Awards. So we hope to see you all there. And thanks again for being on the webinar. We'll see you next time.